I will present the purpose of background information for our topic in which we choose cancer awareness among women in Malaysia. Before I start, I wanted to elaborate more about the cancer awareness in Malaysia. In Malaysia, most of the organizers have been doing this cancer awareness program a lot, but most of the women population in Malaysia still are not aware about how this cancer can be killed, which is breast cancer and cervical cancer. Some people hated to get medical checkup using the mammograms because they think using mammograms can easily hurt them, that they have zero knowledge about what the mammograms function. Furthermore, teenagers have the higher risk of getting breast cancer because of obesity. Other than that, teenagers are not aware about cancer nowadays because some of the education centers do not teach them the different type of cancer and the problem that causes cancer. Now I pass this to the next presenter.
Hello everyone, my name is Rachel Chernanwan. I will be explaining under justification, which consists three parts, which is problem statement, rationale of project goal and objective for our assignment entitled Cancer Awareness Among Women in Malaysia. So for our problem statement, as we all know that cancer is one of the most common causes of death among women in Malaysia. The purposes of our group of doing this awareness is to spread more information about how cancer can happen and how to treat cancer. According to some research, cancer is the most unspoken killer among women in Malaysia, especially breast cancer and cervical cancer. Cancer usually gets treated when it becomes severe and the pain becomes intolerable, and that is when they go for treatment in hospital, but it's already too late because the cancer will become incurable as the stages is already increased to stage 4 or 3. The rationale of the project for our group is to spread more information about cancer among women and to persuade women to do early check-up to detect any cancer to decrease the risk of women having cancer. So for our group project goals and objective, as I already mentioned in problem statement and rationale of the project, our purposes is to spread more information regarding cancer among women and to persuade women to do early checkup. So for the objective of our group is to promote healthy lifestyle among women and to give more knowledge about cancer to women so that they can detect cancer in early stage and can decrease the amount of women die because of cancer, especially in our own country, Malaysia. Thank you.
Hello, Assalamualaikum. My name is Fatia Zohani, and I'm gonna explain about the importance collaboration with the Association and Women's Cancer Organization. There are many purposes of the collaboration that we can get from this point. Firstly is to reduce the burden of cancer for all of people. Like for example, the passion is to maintain a healthy weight, healthy diet, and be physically active in sport. Secondly, it is to provide funding for the treatment with the breast cancer in the community. Like most of the women with the breast cancer will have some type of surgery to remove the tumor, like the doctor who is specialized in the treatment. Thirdly are the researcher that needs to listen better with the patient's problem. Like they need to communicate well with the patient in the easiest term and explain what they are doing will give the benefits of the patient. And lastly, it is to help and improve the organization by collecting funds, organization, like for example, like creating a program for selling used goods, and the proceeds will be put into the fund. There are a few non-organization government like MAGNA, which is National Cancer Council, All Women's Action Society, National Cancer Society Malaysia, and the Persatuan Onkologi Malaysia, which is the Malaysian Oncological Society. All of these government or non-government organizations are having an awareness campaign on cervical cancer, doing a preliminary test, and the HPV vaccine for Malaysian women through social media influence. And that's it. Thank you.
Assalamualaikum and hello, I'm Nur Shazlina binti Ismail. For the cost analysis, there is no cost involved in implementing the cancer awareness among women program. We use TikTok, Facebook, Instagram and YouTube as our main platform to share the video and poster about this program. This is because the social media has great influence on people nowadays. They were being used globally by a lot of people. From social media, we can reach out to the primary target, a woman, to share awareness about the danger of cancer to their body. By doing that, it will help people to open their eyes to take care of their health and their family health. The impact of this program is that people will know more about how the cancer can happen, especially our target audience, a woman. We believe that by doing this program, we can help save more women's life by spreading the information about the cancer. This program will positively impact our society, where we care for each of us as human beings.
Hi, my name is Hasfi Sujin Haikal Binasan and I'm from BA 2402A and I will represent my group to present our infographic poster about cancer awareness among women. According to the infographic, 1 in 6 women can have cancer at some point in their life. Cancer can strike women between the age of 40 and 49. Even though cancer mainly affects older women, it can occasionally strike women under the age of 50. As a reminder, all women worldwide need to be aware of women's cancer. Although studies have found that HPV in breast cancer cells, but the role that virus plays in breast cancer is still not known. HPV can cause other cancer including cervical or vaginal cancer. Every woman should be aware of how her breast typically feel and look so she can spot any changes that might take place. Despite the fact that knowing what to look for, women should still get routine mammograms and clinical breast examination since this can help diagnose breast cancer before any symptom appears. As for cervical cancer, you can lower your risk for cervical cancer by getting screened regularly starting at the age of 21. You should get your first pap test at age 21. If your test result is normal, you can wait 3 years for your next test. We can conclude that it is important to take care of the woman on our family as cancer can be treated. Also, prevention is better than cure. Thank you.